My name is Ed Lunam, and I work for ADMI, Aspen Dental Management. And Aspen Dental Management is a DSO, dental services organization, based out of the Northeast. And Aspen Dental has over 850 offices in 40 plus states. And some of the many things that ADMI does is we handle all the business components for all of the owner doctors and all the clinicians, dentists, hygienists, and specialists, including oral surgeons and endodontists working in Aspen Dental offices. So we handle all of the HR, the accounting, real estate, construction, ordering of equipment and supplies, marketing the practice so that we can get patients in the door for our owner docs and that they can then refer down to Dr. Patel. So all of the very important business components are what we do at Aspen Dental Management, ADMI, which I'm an employee of. And I've been with ADMI for roughly 2 months now. So that's a little background on me and the company I work for. We don't get involved clinically. We're not a clinically led organization. We focus on the business and the business at hand. So if you would, Dr. Patel, if you wouldn't mind just taking a couple minutes talking about your background and anything you want to add and how things are, your experience thus far with Aspen Dental.
Yeah, my name is Chintan Patel. I basically from India, but I did my advanced placement at NYU College of Dentistry, and then I was a general dentist for 2 years, and then I did my residency in oral surgery at Montefiore Medical Center. I graduated in 2019, and I moved to Columbus, Ohio, and I'm basically an oral surgeon with Aspen Dental for Central Ohio region. Covers almost close to 14 clinics now. It's been fantastic. I have a good clinical experience here and a great support from my specialty team from ADMI and practice owners.
Great. One of the questions that have come in so far, I should say, is just quickly would love for you to run through what a day in the office is like.
Sure. So usually usually the amount of usually it's about 8-hour day. Sometimes it's a little bit more. Some clinics opens early, some clinics opens around 9, some at 7, but usually it's 7 to 4 or 8 to 5 or sometimes 9 to 6. You get the lunch break in between, like about half an hour or so. I basically see about 10 to 15 patients depending on the day, plus some consults and a follow-up. On an average, we do about 7 to 8 sedations and some local procedures. I have 2 dental assistants that travels wherever I go, so they are always there with me. Usually I show up about 30 minutes before the schedule, so I do my huddle with my assistant and the manager, making sure that we have all the paperwork for all the patients, every patient, all the supplies that's needed for the patient, and we start around right on time, and then days goes pretty fast. The varieties of procedures are basically dentoalveolar, including multiple extraction, alveoplasty, pre-prosthetic surgeries, dental implants, bone grafting. I also do some biopsies, and that basically the bread and butter oral surgery that we do. And once the day is over, we still have to pack stuff up. It takes about 15-20 minutes, and then we drive back home. I cover about 14 clinics, but most of my clinics are within hour and a half distance from where I live. So I don't have to spend many days at hotels or stuff like that. I have a couple clinics that are like 2.5 to 3 hours away, and for those, I prefer to stay a night there and then travel to a different clinic.
Okay,
I work full time. Yeah, I work full time. I work 5 days a week and close to 20 days a month.
Wow, so you're busy. So that's from a 30,000 foot level here, as far as what you were asked, what a typical day is like. Let's dig into it a little bit, because one of the questions here that's come in is just really getting back to the nuts and bolts as far as the equipment specifically. What equipment does Aspen Dental provide you, and if anything, do you have to get any equipment on your own?
I did not have to get any equipment on my own. Um, we have an onboarding team, like onboarding manager. They come before you start. They will sit down with you. They will ask you about your preferences for scheduling, your preferences for instrument materials, and they will order everything you need before you start your first day. And I did not have to buy anything on my own.
Another question here that's come in here. Um, Talking about procedures here, or asking about procedures. Are most of your procedures under sedation?
I do about 7 to 8, so almost like 60 to 65% procedures are under sedation. Some patients, unfortunately, sometimes they can't afford sedation. That's why some procedure we have to do it under local anesthesia. But I would say about 60 to 65% procedures are under sedation.
And then keeping here in the kind of the equipment zone realm that's come in here is, can you talk a little about CBCT and the
So
use availability?
yeah, so Aspen has an implant initiative now that like Aspen is training all the restorative dentists, giving them more knowledge and information about restoring implants, and they have also roll out this program with more and more offices getting CBCTs. In my region, there are about 3 clinics have CBCTs, and more on the way that I was told. So yeah, Aspen is trying their best to kind of get the CBCT to every clinic. But even if you have like a 3 or 4 clinics in the region that has CBCT, you can always send the patient to that office and get the CBCT, and you can see them remotely.
Here's a great question. When you're talking about the amount of days that you're working and everything, and talking about how you're had started, out of residency, and the question is do you feel it was a big undertaking to start working as the only oral surgeon in the office straight out of residency?
Yep, it's the first year out of residency is always interesting. As my attendings told me that the amount of learning that you will have within first year will be more than 5 or 6 years spent in the residency. So of course, when I started, it takes a while, but it's a lot of responsibility. But I guess that's where the residency training comes in handy. All the emergencies that you have handled during the in-office sedation procedures, your anesthesia training, and also all the complications and all those M&Ms that you had during the residency. Um, it comes in handy. But let me tell you one thing. Aspen provided me everything that I needed, and every office has all the stuff that's needed for Mayo stand, IV poles, oxygen tanks, the anesthesia monitoring cart, the emergency medications. And like when you start, you don't see that many patients in the beginning, because the thing is that you are still getting enrolled within the insurance networks and stuff like that. So initially your patient load will be a little bit less, but I think that's the great time for you to sit down with your staff, you sit down with your assistant, and try to create a system where you try to find the problems before it happens and you kind of correct them. So I think initially you will have some time to sit and think about it, and then you will create your own system. Um, I still keep in touch with my attendings and my fellow colleagues, in other DSOs as well as the DSOs, and we talk about complications and how to prevent them.
You mentioned you keep in touch with your colleagues from what, and this is the question that I just had. I mean, where did you mentioned your residency training, you're keeping in touch with them. Where, your friends, your colleagues who finished their residency and you keep in touch with them, did they, some go private practice, stay in education, DSOs? Was it a little bit of a mix?
Yeah, it's a little bit of a mix. We always talk about every week, we talked about if you have any complications or if you saw certain patients, if we share like clinical findings and the radiographs, and we try to come up with like the almost like, like it's almost like our conferences, like where we kind of like, get each other's opinion and try to get the best outcome for our patients.
And then another question that came in, you mentioned that Aspen provided all of the equipment that you needed, but did you get to choose, the brands, the manufacturers?
Yes, definitely. When the onboarding manager will come, they will ask you your preferences for what kind of like, all the surgical instruments you need. Fortunately, I was trained with Nobel Biocare in my residency, and Aspen provides a pretty good discount. Like they get a pretty good discount for the Nobel Biocare implant. So I get to choose all the instruments and the material that I wanted, and I had all of them.
Another question that's come in here regarding equipment is, and you mentioned the amount of offices. So the question is, how do you transport your equipment and instruments?
Sure. So Aspen is a great program for like, if you work full time, the company can provide you the car. So I got the car, like the SUV from Aspen. It's a part of the specialist program. So then I carry all my stuff in my car, and a couple of other stuff, not very important stuff, my assistant will carry in their cars too.
Okay. Um, Another question that's coming in here. Why did you choose to work for Aspen instead of a private practice?
Well, I had a few interviews with private practice, like group practices. The one thing that I would like to share is that, when somebody hires you, they want to increase their volume. They don't have enough patience for you to kind of like, just go in and then start, treating those patients. Basically, you are trying to create your own market, means that you have to do your own marketing. You have to meet the general dentist and try to create your own referral base. If I have to do that, then I would have opened my own clinic from the day one, while the Aspen, what they provide is that they will give you 14, 15 clinics, or how many clinics you want. And what they do is that they are all behind you. They want you to be successful. They will try to feed you the patients. And I think for me, I think that's the best way to start my career. And uh, not only you can be financially successful, but also you learn a lot too.
Okay, great. Moving onto the procedures and consults. Do you do your own consults?
Yes, I do my own consults, especially for implants. Of course, like, wisdom teeth, somebody needs a full mouth extractions. Unless they are like, medically complex, then the managers and the doctors will put them for a consult for me to take a look at them and, answer any questions that the patient has. And basically, I do the history and evaluation and then get the medical clearance. But like straightforward, like 16-year-old needs like a wisdom teeth, I don't do consults for that. But definitely all my implants and medically complex patients, I do evaluation or the consults first.
Okay. And then all your referrals, question here, your referrals come from the doctor down the hall. Do you have to run treatment plans by the doctor, by the referring doc, the owner doc?
So I've created a system where every time the patient, for any procedure that comes to me, the general dentist in the office will have to write a written referral for me. And usually I review all of them beforehand, and I have created a system where if I have any question, because what you can do is that you can remotely log in from like from and just check all the x-rays, the medical history and everything a week before. And if I have any questions, if I see something, then I always give my referring doctor a call and try to sort the issue out beforehand. But yeah, communication with my referring doctor is not a problem. If you have any doubts or anything, you can always clear them beforehand or on the day of surgery. And I haven't had any big issues with any of the treatment planning. And you have to remember that when you start, you will get to meet them. You will have a dinner with them, so you can go over all the preferences. The Aspen has the Aspen intranet where your scheduling preferences will be available. all your all the forms that you use for all the procedures will be available for each doctors and the manager in office to take a look. And as you work with them for a few months, I think it like they know what you can and cannot do and how you would like to proceed further with certain procedure, and it gets easier.
Great information there. How about the very important assistants? Let's see here. The question is, how many assistants do you have, and do you have this? Are they the same assistants?
I have the same assistant everywhere I go. I have two assistants. One basically maintains the position of the head, works from behind, and the other assistant will be a chair side, and they go to each and every clinic. I only have two assistants, and they never change it. They always be there with me.
They're gold, huh?
Yeah, you gotta train them. You gotta make sure, because with they are your they make you successful. You are as good as your assistant, so you got to make sure you keep them happy, and they'll make you successful.
Yeah, let's see. So another question here. And then how much time are you typically given to see patients when you were just starting out? It sounds like, think kind of more of the freshly out of residency. When you're first starting out, how much time are you typically
Yeah.
given?
So when you get onboarded, when you start, the onboarding manager, the regional managers, everybody will ask you about your preferences, the amount of time you need. So you can pick and choose how much time you need for each procedure. A set of full bony wisdom teeth, or like a full mouth extraction, and you have the ability. Let's say after a few months, if you want to minimize the time by 15 minutes, you can always contact the person at ADMI, and they should be able to kind of set your preferences again. So nothing is set in stone. When you start, you can pick and choose how much time you need for each procedure, and after a few months, as you are more familiar with the system, your assistant gets better with means they get better at assisting you, and you become more efficient. You can always change the scheduling preferences. I usually typically takes about 45 minutes for a set of wisdom teeth, probably about hour and 15 for full mouth extraction with alveoplasty, and implants. It's different. If I'm placing 4 implants for like implant supported overdenture or something like that with extraction of all the teeth, then takes about 2 hours or hour and a half.
Let's see. Next question. I'm looking over here at my other monitor so I can see the questions coming in. Other question is follow up. You mentioned going to the multiple offices. You support multiple Aspen Dental offices in the Columbus, Ohio area. How are post-op patients handled in the case if you have a patient with a severe infection post-op or something like that?
Right. So I usually I cover most of my offices twice a month. So I usually see my follow up every 15 days. But yeah, I agree. Like, some once in a while you will have the complications, and you want to make sure that you want to see the patient earlier. That's why having a good communication with your referring doctor is important, because they are always there. So I always keep in touch with them whenever I have a patient. Like, if I feel like, is there any chance of any paresthesia, or if there is an oral communication that happened and I closed it, I always keep in touch with patients. And usually the clinics are not that far apart. Some clinics are within half an hour distance. So sometimes if I see a patient in, let's say, a Columbus area, and then like I have like the next week I am at the office that's like 15-20 minutes from that office, I usually schedule them so that they can come and see me over there. So for me, so far, I don't have any big issues with like, following up with patients.
So this next question, going to your traveling here, it's asking about do you find the travel from clinic to clinic manageable?
Yes. As I mentioned that I have about 14 clinics. I have 7 clinics within less than an hour distance. 3 clinics within hour and 15 to hour and a half, and only 3 clinics are probably close to 2 to 3 hours. So I don't find like, it's I don't find that it's not like, it's really tiring. It's manageable. It's quite manageable. Initially, yes, you might feel like, you're driving a lot, but once you develop a system, and when you get like, when you get used to the situation, I think it's pretty manageable.
Okay. Question here asking about the Aspen Dental and asking you, doctor, what characteristics does an oral surgeon, I guess non-clinically, should they have to be successful in the Aspen Dental model?
Well, I would say that, whether you're in private practice or you are in Aspen Dental, having a good communication and, keeping a referring doctor happy would be the most important thing, because they are the one who are feeding you the patients. So, um, being like, and also the managers in each clinic, your assistants, of course, you got to make sure you have a good communication with them. You got to be amicable, and also the regional managers and the practice owners. So it's kind of like, one thing that I've learned is that, the more predictable results are for your procedures, everybody will be happy. Your patients will be happy. I always sometimes, I give, like, all my patient gets my card with the number. Aspen has a system where, they have this answering system. So I always give all my patients that card, so that, if they have any issues, they can always contact me, because sometimes what happens is that, like, the patient will call the referring doctors, and they are busy. They're also busy, so you want to make sure that you provide a predictable results, and then having good communication with the clinic staff as well as the referring doctor would be the most important thing.
Great, thank you. Let's see here. So next question, it looks like we're heading into compensation and benefits and I guess the package, if you will. Does Aspen does Aspen cover your malpractice insurance?
For the full time, I don't know about the part time, but full time they cover $10,000 per year for malpractice insurance.
Okay. And then how about talk a little bit about the benefits that are part of your, in addition, healthcare, medical, if you would, please.
So Aspen provides the medical insurance. Of course, you got to pay a certain premium, but they provide that, and also uh, they have 401k program for first year. After first year, they will match it for you, and then also has this. The Aspen has for full-time doctors, they have this car program. So basically you pay about $300 every month, but that's before tax. And I think that covers everything. That covers the insurance for the car, all the repairs, and the gas.
Okay. And then this one just came in, very important question. How are oral surgeons compensated at Aspen Dental?
I'm pretty sure that Veronica can give you more information about it, but you get a certain percentage for the production, and then certain expenses will be taken away from that, like the material cost for each month, and that's about it. I think Veronica should be able to give you like a more insight into it, but it's uniform across the all the region. It's not like, like it's not uniform. It's the same package that everybody gets.
Okay, got it. And for our audience, Veronica is part of our specialties team, and all interviews. Veronica leads all the interviews at Aspen Dental Management for all the specialists. So she's a wealth of information on the compensation. Okay, let's see here. Let me check my Q&As here that are coming in. Looks like the COVID. We're talking. Looks like we're moving into a question here about COVID. And if you could, Dr. Patel, how have you seen the offices affected due to COVID?
Yeah, so when COVID hit, we didn't know, like, we got shut down here in Ohio for about 5 weeks. And when we came back, I was really worried about it. But Aspen has done a great job. When we came back, I thought that it's going to be like a very slow recovery back to normal. But after 15 or 20 days, we started seeing a lot of patients, and I was really impressed with the amount of work that Aspen did to bring the patient back into the office. It was scary in the beginning, but overall, this year has been a pretty good year for me, except for that April, like 15 to 20 days in April, where we got shut down. Other than that, we are still seeing a pretty good amount of patients. If you see compare the averages from the last year, it's not down. Like it's almost comparable. So I think we lost few days, but I think we covered up pretty well.
And then were you provided with all the proper PPE and you felt safe in there while in the offices, your staff, your assistants, the patients, with all the equipment that was provided?
Yes, Aspen has delivered a lot of PPEs. They have provided N95 masks right before we came back from shutdown into the COVID, and all the clinics have been supplied with enough gowns and face shields and like shoe covers and hats and everything. We haven't had any issues here in my region with the lack of PPEs. They always all the Aspen clinics, they have information right outside the door. Everybody gets in with a mask. Everybody gets the temperature checked. They fill out the COVID questionnaires. They also sign the COVID consent. Means that they acknowledge that they are at the risk of, means they are basically they just waive the any liability that if they contract COVID in the office and stuff like that. And also every patient that gets in gets the hydrogen peroxide mouthwash before you see them. So we have done everything we could from our end, and I cover 14 clinics. And knock on wood, I have never heard any of my referring doctor got sick or they got hospitalized. All the supporting staff, including all the assistants, manager, none of them have gotten severely sick from COVID.
Well, that is a blessing for indeed.
And knock on wood.
Another question here, asking about like interviewing and job hunting. When did you start aggressively interviewing for jobs?
Right before, like 6 months before I graduated. So I'll be close to November, December. I really started aggressively looking for a place to work.
So right about now for any of our
Yeah.
graduating residents in attendance, right about now. Okay. And then the other part is that is how, where do you recall where you look for jobs and how you went about the interview process in terms of looking for jobs?
So during the residency, the program chairman, program director can help you, if you're looking for a certain region to work for, they can be helpful. Of course, you can go on AOMS website, and they post the job posting too. And also, unfortunately, due to the COVID, like the all these annual meetings and stuff like them are online. But um, contacting the recruiting persons from different DSOs and stuff like that can be helpful too.
Okay, here, let's see another question. What's been the biggest misnomer, surprise about working with Aspen Dental and a DSO?
It can be really busy. I didn't expect that it to be really busy. Certain months are really, really busy. Usually, like summer times when the kids are out of school, you get to see a lot of wisdom teeth. One day I've had like almost like 12 sets of wisdom teeth. So I didn't know that it can be that busy. We like it, but it can be tiring. That's the like you gotta one thing that I've learned is that like the managers and the referring doctor, they are working really hard to build your schedule, and you got to go with the flow. Means that and that's the reason why I cover clinics twice a month, because the thing is that if they have so many patients, then you need certain time, but then also you want to support the clinic the best you can, so that they want to build your schedule. They will build your schedule as long as you're willing to work with them.
Okay, another question, and you may have touched on this, but we've had another attendee join after we started when you were talking about procedures. But questions about implants. Do you how many implants do you place per day on average?
Uh, every day is different. Sometimes you have multiple implants, like 6, 7 implant in a day, and sometimes you don't have any. But on an average, I was looking at my implant log. Places about 25 to 30 implants a month. In past year, I have placed about like close to 350 to 400 implants.
And another part to that question, is there what implant system? Is there a mandatory implant system that you have to use?
It's not a mandatory implant system. You can pick and choose what you like, but one thing is that I think most of the doctor in Aspen Dental, all the restorative doctors, they are used to Nobel system now. Nobel gives a pretty good discount to Aspen, and the quality is great. I personally use Nobel Active. I was trained in residency for Nobel Replace Select, and the transition wasn't that bad. But like you got like from my perspective is that I can place any system I want, but as long as my referring doctors are comfortable with the restoring those implants, that's why I like to keep it simple and just use one brand and a one lineup, and try to keep things simple for my restorative doctors.
Question here. Do you do oral surgery on Saturdays?
I don't work on Saturdays. I work Monday to Friday. Once in a while I go to one of my busiest clinic. Luckily is like 15 minutes from where I live. So sometimes if I want to see a couple patients for a follow-up and stuff like that, I may have stopped by at the clinic, but I don't work on Saturdays.
Good for you. Good to have that day off to rest and recoup.
Of course.
um, what was the interview process like with Aspen Dental?
Um, so I was fortunate enough that one of my senior was working for Aspen, so I got most of the information from him. But when I contacted the Aspen, they set me up an interview. I believe in the December. I went to Rochester, New York, where the ADMI is. I had an interview with Veronica, who is a director of the specialty division. Once I got interviewed with her, she gave me options of the region. Then when I looked through the region, I talked to my family. We kind of decided for a one region like a Central Ohio that we liked. Then I came here and had an interview with the practice owner, Dr. Laki Reddy. Once I met him, then he gave, like, it was in the clinic, so we sat down together. We looked at the number of offices, potential production that can happen from each offices, and then after that, I think we clicked. I liked Dr. Reddy. Dr. Reddy liked me, and then then we agreed to work with each other.
So just a couple of, as you said, just a couple of interviews. One in Rochester, Syracuse with Veronica, and then one with your owner doctor. Correct?
Yes, yeah. So once I gave Veronica that I'm interested in this region, she set me up an interview with practice owner.
How about other specialists? Do you ever see the endodontist in your offices?
Uh, so uh, so I cover Columbus and Cleveland. Cleveland region has an endodontist, but two specialists will never be in the same office because we use the same app. So we don't see we see each other in like our meetings and stuff like that, but we don't work in the same office at the same time.
Okay, it made me think of a question here. You mentioned you have the two assistants, but how many operatories do you typically get when you go into an office?
Yeah, I usually get two operatories in all the clinics. One is for like, one is for sometimes, I get double booked. So if I have sedation, I have a local anesthetic or anesthetic case the next door. Or like, if I have a consult, I have a follow up, stuff like that. But I do only one sedation at a time. And then I sometimes, if I'm really busy, I get three ops. But usually, usually I can get away with having two. But getting more ops is never a problem with me. All the managers, in my region, like, all the doctors, they are pretty friendly. If you need more room, they'll be happy to share more space with you.
And it's safe to say those patients, all their insurance is taken care of. They haven't eaten. They're fasting if they're going anesthesia. They're just, everything's done from a non-clinical perspective so that you can start oral surgery each and every day.
Absolutely, yes. So when you get boarded, you're all the documents that I was talking about, the Aspen intranet, like all the documents will be available for each and every office manager and the doctors. They will give patient a pre-op instruction, post-op instructions. They will give patients all the consents to take home to review with them, and all the medical history and the radiographs will be available for each and every oral surgeon to review. Uh, Many days in advance. Sometimes they add a case a day before. That's another story. But usually they let you know if they add any cases at the last moment. They'll make sure you're okay with it. But everything will be taken care beforehand. And I strongly recommend using a surgery checklist and getting your assistant trained to just ask questions and fill out the checklist before you walk in, so that when was the last meal, the allergies, any medications they take, if they have any medical clearance from their doctors, everything will be ready to go, and escort and everything will be available. Right?
Great. Any pressure to or any competitive hierarchy amongst the oral surgeons within Aspen Dental to produce, or bragging rights, along those lines?
Well, like uh, it's some doctors, and I guess some seasoned oral surgeon that work for Aspen for 15, 20 years, they have developed a system. They have developed their own system. They are very efficient. I just started 15 months ago. I'm not trying to compete with them, but again, I told you, like, I've never expected. The only surprise I got is I have never expected to be this busy. Certain months will be really busy, but safe to say that like out of all these oral surgeons, you can check your matrix. You should be able to see within the Aspen organization where you rank. Like amount of implant you placed, amount of procedures you do, consoles, your production, and like I'm usually within first 15, so I think I'm happy.
Great. Oh, here's another question. I'm considering Aspen. What would be a good next step?
Well, next step is get in touch with you, Mr. Lunam, and then get to meet Veronica, and uh, you know, uh, and try to explore like the regions and stuff, and then you got to meet the practice owner, make sure that it's a right fit for you, because as I mentioned before, like whether you're in a private practice or you work for Aspen. Um, Having a good communication with the practice owner and the referring doctor is the key for success.
Yeah, you've mentioned that a couple times. The practice owner, and it seems very important to you. And as you've mentioned a couple times, it goes without saying. It's whether it's private practice or in a DSO, cultivating those relationships with the practice owners is a key, huh?
Absolutely.
And when you're only in there 1 day or 2 days a month, it makes I suppose it could be challenging. So how did you go about doing that besides just being yourself? Is it just walking into the office and being confident in your abilities and taking ownership of oral surgery?
Yeah, so like when when you join an organization, they will give you ample opportunity beforehand. Like you will get, now it's COVID, it might be a little different, but you get to have the dinner with them. They will set up a meeting where all the doctors, all the managers, everybody will just come and like ask you questions, your scheduling preference. And like when I'm in the clinic, when if I'm not busy, I always uh, sit with them if they are not busy, and and try to like make the game plan. Like uh, when you start, like the expectations from the doctors and you should match. Means that like if you want to place more implants, you got to talk to them, make sure that they are comfortable doing certain cases. Like for example, certain offices that I place more implants because the doctors are more into restoring implant, they like restoring implant, and you just have to like like you just have to cultivate, or like you just have to make that relationship with them to make sure that uh, they treatment plan more implants for you. And same thing with any procedures, any preferences you have. When I started talking about, like, first, I wanted to talk to all the doctors about, like, sedation, what are the criterias, when can we sedate and when can we not sedate patients, BMI, certain medical history, and then like the preferences for coding. One thing that I've learned coming to Aspen is that coding is important. In residency, we don't care about coding. Like we like to do procedures, and we like to be busy. But when you are in private practice, you got to make sure that you code things properly. How to code wisdom teeth, and make sure all the managers code them correctly. Because the thing is that sometimes what happens is that if they code like uh, partial bony instead of full bony, it could be difference of few $100, but at the end of the year it could be a lot of money. So like uh, I when I started, I spent a lot of time, like some amount of time when I started, like first few months, talking to managers. Sometimes I took them for lunches and stuff like that, and make sure that they get your perspective. uh, and that's why the good thing is that I like to check my x-rays and medical histories and treatment planning a week in advance, so that if there is any discrepancy, any changes in the code that needs to be done, it's done well in advance, so patient won't get any surprises and stuff like that.
That was a lot of great information. Thank you. And I think it answered one of the questions that came in, asking if you ever do lunch and learns with the office staff, or you're the general dentist. Who are your referring docs? Those are referring docs, or those docs working right down the hall. Um, so it sounds like you might grab lunch or something from time to time with
Yes.
with your colleagues.
And yeah, when you start also like the regional manager, so there's a one more person above all the managers, and they cover about 6 or 7 offices. That's your go-to guy. They will come to your offices. They will ask you if you have any problem with the managers, the doctor, the staff. Like they are the one trying to help, like sort out any issues you have. And when I started, like my regional manager used to travel with me to each offices for first 15-20 days, and the regional manager used to bring lunches for the whole office, and we used to sit together, and like like it's almost like
Oh, Dr. Patel, you're on mute.
sorry, can you hear me?
Yes. Yes, we can.
Yeah,
Thank
so
you.
the regional managers can be a great help too. Like when you start, like they will come to each office with you, and they will try to like break the ice for you. They will try to make sure that you are comfortable with the staff, and the same thing the other way around, that the staff is comfortable with you.
Great. Good information. Thank you very much. Well, we've covered quite a bit in 45 minutes. Talking about equipment, Aspen Dental, some COVID topics, talked a little bit about compensation and benefits. We had a lot of great questions, a lot of great insight from you, Dr. Patel. anything you'd like to wrap with, Dr. Patel? Any parting words of wisdom for any of the residents in attendance tonight?
Well, if you like to be busy and you like to be successful, I think working for Aspen is pretty good. Always, having a good relationship with your referring doctor is the key for success. I can't stress enough. That can make or break your, that can be like the most important thing, having a good relationship with your practice owners and the referring doctor. And when we operate, we all gonna have complications regardless. But the thing is that if you have a good relationship with the offices, most of the complications can be easily managed. And that's about it.
Great. Well, thank you to all of our attendees in attendance tonight. Appreciate all your great questions, and taking some time to learn a bit about Aspen Dental. And to you, Dr. Patel, thank you so much for your time and enlighten us all these residents on things to look for, possible pitfalls, and most importantly, a day in the life of working as an oral surgeon in an Aspen Dental office. So thanks again to all for your time and attendance, and let's stay in touch. Aspen Dental has got opportunities for oral surgeons across the country. So please keep us in mind. We've got a virtual vibe coming up next year. So a lot of opportunities to learn more about the organization and interviews. So to everyone out there in attendance tonight on this Ask Me Anything with Dr. Patel, thank you so much, and have a good evening.
And good luck to everyone. Thank you.
Good night.